With that, the question is, how can I improve my sleep? So sleep is definitely one of the pillars we use at the Andrew Weil Center for Integrative Medicine and at the Institute for Functional Medicine. It is a pillar of health. So the things that I'm going to discuss with you are these approaches from both of these institutions. So one of the things that I find that many people are surprised about is alcohol. Now, we sometimes turn to alcohol because we think, all right, it makes me tired, it actually helps me sleep, but really in reality, there's enough research and studies to show that it does not actually help you stay asleep, because what happens is it might help you go to sleep at that moment, but during the night, alcohol decreases your REM sleep early in the night. And then when the alcohol wears off, there's this REM sleep rebound phenomenon with prolonged REM stages. Now, if you remember when I was talking about the stages of sleep, we want them to be in certain amount intervals, right? So if we're messing with that, we're already messing with our ability to recover. So you definitely want to avoid alcohol within that 3 hours of bedtime. Another thing to consider is caffeine. Now, everybody metabolizes caffeine differently. For many people, stopping caffeine at 2 p.m. will be a good amount of time. Some people are quick metabolizers and they can metabolize it in 6 hours. Some people, it actually takes them 12 hours to metabolize. So that is a very individual thing. So I know a number of individuals who will tell me that they go for their coffee at 3 o'clock in the afternoon just to get through work, but then they have sleep problems. So it is something to consider, because part of that might be you still have caffeine in your body. Another thing to consider is if you do have allergies or you take something seasonally, Sudafed and decongestant medicines at night can also be stimulating and disrupt your sleep. Then also keep in mind any medications that you're on that might be contributing to sleep problems. So it's definitely worth, when you go and pick up your prescription with your pharmacist, to ask, do any of these that I'm taking contribute to sleep issues? Just to be aware, because that might require adjusting the timing of when you actually take the medication. This definitely comes into place when you're taking supplements, because I know many people who don't realize that they shouldn't take their multivitamin late at night, and then they pop it late at night and they wonder why they're wired. Well, those B vitamins are going to keep you up at night. So definitely talking to your physician and your pharmacist about this stuff is very important. And then another thing is, try and complete any aerobic exercise before 6 p.m. or at least 3 hours before bed. Now, when you do aerobic activity, you are actually increasing that sympathetic response. So then you are increasing the amount of cortisol, which is your stress hormone, coming out of your body. So we really don't want that. We actually want cortisol to be released in the morning. So there's a reason why, some people do suggest exercising in the morning. That's when our cortisol levels are the highest, and our body naturally likes that. Now, another thing to consider is nighttime tension and anxiety. Well, it's not always easy to avoid anxiety-provoking activities, but there are some to keep in mind. One of them, which is watching the news before going to bed. There's a lot of interesting things going on in the world, and there will always continue to be. That's what news does. And when they actually did research on individuals who watch news, that they have increased levels of anxiety. And anxiety, it's almost like, which one comes first? Does the anxiety come first and then the sleep disturbance, or does sleep disturbance? It becomes a cycle. So avoid watching news before you go to bed. Also avoid reading stimulating, exciting materials in bed. So this is where you really want to have easy reading, nothing too stimulating. Avoid paying your bills before bed and even checking your financial reports. Avoid arguments before bed, and really kind of avoid any negative judgment about sleep, that you're unable to sleep, that you have insomnia. That actually will increase your anxiety when you start thinking about how you can't sleep. How are you going to sleep tonight? So do keep that in mind. Now, what can you do? Well, think about using positive self-talk phrases that you can fall asleep, you can relax. There is a reason that people have positive mantras or positive affirmations that they say. They do work. Consider also getting your thoughts out of your head and onto paper. So writing in your journal any thoughts that are kind of in your head that are preventing you from sleeping will help you also process them. So then you can have a better sleep. And then there's also two other things which you may or not be familiar with, but one of them is called yoga nidra. Now, before you tell me you can't do yoga, this is not the kind of yoga you're thinking about. This is actually a type of yoga which is almost a cross between being awake and sleep. So it's like a middle state of consciousness where you're being guided into a relaxation state with different parts of your body. So if you were to go to practice yoga nidra, you can go to a video online, type in yoga nidra, and they're like 45-minute videos that will guide you through this progressive relaxation of your body to help you sleep. Another thing to consider is to do breathing. So one of the breathing exercises that I like to do is alternate nostril breathing. And this is not something that takes that long. It's just a few minutes. You can try that. You can also try the 4-7-8 breath, which you can do under a minute. So there's a number of techniques that you can do to help. Now, do realize when you're doing these, what you're doing is really getting your body into a parasympathetic state. And if you remember when I said sleep is the ultimate parasympathetic state, so they go hand in hand. Now, how can you plan for your sleep? Well, plan to put sleep in your schedule. Clock it in, all right? You are sleeping from 10 o'clock to 6 o'clock or 11 o'clock to 7 o'clock. Try and also go to sleep and wake up at the same time every day. This is what's going to train that biological clock. You can begin prepping for bedtime about 30 minutes before getting into bed. Avoid those late afternoon or evening naps. Also avoid napping for more than 45 minutes unless you're really sleep deprived or you're dealing with a sickness or illness. Consider avoiding large meals or spicy foods before bed. Try and stop eating about 3 hours prior to going to sleep, because what happens is when we go to sleep on a full stomach, our body's a little confused. It doesn't know, should we be digesting the food right now or should we be sleeping? So trying to limit that can be helpful. Also, I know a number of patients who tell me they wake up in the middle of the night to go to the bathroom. Well, you also want to avoid drinking a lot of fluid closer to bedtime. So if you're trying to get in your water or your fluids, try to get them before dinner time and throughout the day. Actually, your body will be able to utilize them more if you do them continuously throughout the day than all at one shot. Also, taking a aromatherapy salt bath can be really helpful. And that warm bath or even a hot shower actually raises your body temperature before sleep to actually induce a sleep state. So there is a nighttime bath ritual you can consider. Super easy to do. 1 to 2 cups of Epsom salts, and that's really to be absorbed in the skin and to relax the body. You can add some baking soda to it to alkaline alkalize the stressed out body, and then even lavender oil will help lower your stress levels as an essential oil. So that's a super easy one. You probably have quite a bit of these ingredients already in your house. And then what do we do if we have trouble falling asleep or staying asleep? Well, so here's the thing. If you're in bed and it's taking you longer than 20 to 30 minutes to fall asleep, leave the bedroom, okay? The bed is essentially for two things, for sleep and for sex. So if you're taking too long to fall asleep, leave your bedroom, go to another relaxing part of your house, do a relaxation technique, maybe one of those breathing techniques. Consider reading. Make sure you have kind of that low light setting, not the bright TV blue light, or if you're reading from a Kindle or something, you can do the setting where it's a lower light for the brightness. And if you're somebody who wakes up because of light, like light comes in and you're waking up, consider even an eye mask or even curtains that keep out the light until your body naturally awakens. And once again, if you awaken early because of recurrent thoughts, keep that journal by that bedside. I mean, write it down and then go back to sleep. You know, it actually is quite helpful. Now, when we're thinking about our environment and how do we set up our bedroom to be most optimal for sleep? Consider turning down the light in the bathroom and in the bedroom about 15 minutes before going to bed. So if you do need a night light, maybe put it in the bathroom where there's a little bit of a low light. You can also use dimmers in your house. Consider amber glasses before bedtime to reduce that light exposure. As I already mentioned, dark window shades or eye mask. And then if you're an individual who's sensitive to noise and you live in an environment where, you know, there's police sirens and all this stuff, consider closing the windows, using earplugs, or even using a white noise generator. Also look around. Do you have appliances that are kind of ticking away or buzzing that might be interrupting your sleep? Look at the temperature of your room. You don't want it to be too hot or too cold. One of the things that we are all pretty guilty of is sleeping near electromagnetic fields. Now, for some people, it does not bother them. But for some, they can be super sensitive to this. And when you're trying to deal with sleep issues, you really want to create the best environment possible. So putting that cell phone away, and if you have an alarm clock, putting it at the other side of the room, keeping those electronics as far away from your body as possible. And if you sleep with an electrical blanket or something that warms your bed, use it to warm up the bed, and then once you get into the bed, turn it off because that's still an electrical current. Also consider, take a look at the pillows you're using. Try and use hypoallergenic pillows if you're sensitive to that. There's a number of really good sleep pillows and body pillows that can really help you align your body so you can have better breathing and you can have less pain, like especially if you experience arm and shoulder pain, whether it's from your sarcoidosis or from other comorbidities. Having these pillows can really be supportive. Consider sleeping on the highest quality bed linens that you can afford. So when it comes to supplements, now here's my little disclaimer. Do not go out and buy these, first of all, until you work with your own physician, okay? But these are ones that you may want to talk with your physician about and see if they may be beneficial once you have, you know, all your medications checked, all your other sleep factors checked. Melatonin, as you've heard, so our body naturally produces melatonin, but some people could use a little bit more. So 1 to 5 milligrams can help to fall asleep, and then 5 to 20 can help to stay asleep. So this is why I recommend to people, don't just go buy an over-the-counter melatonin. You really want to look at what aspect of sleep is being impaired, so you're getting the therapeutic dosage to address that. Other things to look at are 5-HTP and taurine. And then a big one is magnesium. So even though they say 200 to 400 milligrams of magnesium for sleep, I actually test my patients for their requirements and their levels of magnesium. And I find that many people actually need a lot more than this. So they might tell me that they've been taking magnesium and it doesn't work. Well, when I test it and I see that they actually need 800 milligrams, there's no wonder it doesn't work, because their body has a different requirement. Then also we want to consider some other things. Like things that can lower our cortisol or stress hormone levels. And those might be things like ashwagandha, which is an Ayurvedic herb, L-theanine, or other calming herbs. Tea is a very good habit to have in the evening. Now, when you're saying tea, you're like, you just told me not to have caffeine. Well, no, specific teas. So these are things like lemon balm and passion flower. These are decaffeinated teas, and there's specific ingredients that I will show you that will help with that sleep onset. And then another thing to consider is light therapy. So this can be really helpful in the winter, and especially in the north. So in the winter, when you wake up to go to work, it's still dark. So your body doesn't really know what is going on. So consider having light exposure first thing in the morning. A lot easier to do when it's summertime. So getting that half hour of exposure first thing in the morning. But in the winter, a 10,000 lux bright light box can be really helpful. So, and then are there any foods that can be helpful for sleep? Nuts such as almonds, walnuts, pistachios, and cashews can be considered good for sleep. And the reason being that they actually contain essential minerals like magnesium and zinc, which are important for sleep processes. One food that they have studied that is beneficial is tart cherry juice. And so when cherries are in season, grab them. But when they're not in season, you can get tart cherry juice or even frozen organic cherries. And the sleep effects of cherries is due to the high amounts of melatonin. And the study that they did was that, so adults with insomnia drank 8 ounces of tart cherry juice twice a day for 2 weeks, and they slept 84 minutes longer and had better sleep quality compared to when they didn't drink the juice. So to me, that's one of those non-medicinal, but yet beneficial things that can really help. Even though it was a small study, there is benefit there. So as long as you don't have any allergies towards it, it's something to look at. Now, I did mention those teas. So I am a big fan of tea. One of them being chamomile. So why does chamomile tea work? Well, chamomile, first of all, contains flavones, and flavones are a class of antioxidants that reduce inflammation. When you think of sarcoid, we're thinking inflammation, right? So not only is the chamomile tea going to help with the sleep, it's also going to help with your sarcoid. Now, there is some evidence that drinking chamomile tea can boost your immune system, reduce anxiety and depression, and improve your skin health. Plus, there is some unique properties that improve the sleep quality. It contains an antioxidant called apigenin that binds to certain receptors in your brain to promote sleepiness and reduce insomnia. Another study found that women who drank chamomile tea for 2 weeks reported improved sleep quality compared to non-drinkers. So now I've already given you tart cherry juice, chamomile. So before you go buying that melatonin, let's try these things and also eliminate all the other factors that we possibly can. And then those who drank chamomile tea also had fewer symptoms of depression, which is, as you know, commonly associated with sleep problems. Now, if you don't like chamomile tea, you can consider passion flower tea. Passion flower tea also has these flavonoids that reduce inflammation, boost immune health, and reduce heart disease risk. This has also been studied, the passion flower, to reduce anxiety. Passion flower also has that same apigenin that I had mentioned to calm the brain and bind to those receptors. There's also some evidence that passion flower increases the brain chemical called GABA. And GABA is something that works to inhibit the brain chemicals that make stress. So GABA is something we actually want. Then also the study that was done around passion flower tea was that 41 adults drank a cup of passion flower tea before bed, and they rated their sleep quality significantly better when they drank the tea compared to when they didn't drink the tea. Very short study, only 7 days with a small amount of people, but I don't see any harm in this, trying this. Then the third one is lemon balm. So historically, lemon balm has been used as an antiviral and antibacterial medicine to treat infections and viruses. It also has the potential to help restless sleepers. So if you're more of the person who can fall asleep, but then you get restless, this might be the type of tea that you want to try. It can also help with reducing anxiety and depression. And so there was a study that was done comparing lemon balm to traditional antidepressants, and the participants who took lemon balm, and not in the tea form, but actually took a herbal of lemon balm, improved qualities of life scores compared to those who did not. So, but a lemon balm tea can also be helpful if you're struggling with that restlessness and anxiety before bed. Before you even get to the supplements, it might be worth looking at. Now, just like your bedtime routine is important, so is your morning routine. Think of it as just as important, because you want to wake in the day as mindfully and with purpose and intention as much as you can. You want to awaken and slowly explore your breath, even consider a breathing practice in the morning. And then of course, that 20 minutes of light exposure in the morning, even if it means that you're waking up, making your coffee, and you're sitting on your balcony or on your front porch with that cup of coffee. Get that light coming in, that natural sunlight, that day. It sends signals to your brain to tell your body that increase your natural cortisol that you need when you wake, okay, and slow down on that melatonin, which you want during the nighttime. So there's processes, biochemical processes going on there. And then I did want to give you some additional sleep health resources. So one of these is called the Insight Timer app. So this is an app you can put on your phone, and it has a number of sleep meditations, some talks, and music tracks that will help calm the mind, relax the body, and prepare for sleep. Another thing is that if you really want to geek out on the science of sleep and where your specific body is, using sleep trackers can be very beneficial. I use something called an Aura ring, and it has been really informative to me to plan my days. And it also gives me the leeway when it tells me that my body needs rest, so I don't have to push myself as much. And then I've already mentioned Dr. Ruben Nyman, so you can check out his work at his website, the American Academy of Sleep and the National Sleep Foundation, and other locations where you can get more resources. So for tonight, I want to leave you with final words of sleep well and be well. If we could all sleep like puppies, that would be amazing. And you can always locate me at drbhanote.com. On social media, I'm at Dr. Bhanote on Instagram, and on Facebook, I am